All right. Hi, Betty. My name's Dalen. I'm a student nurse with NTC. Can I get your name and date of birth? And she tells me. So, Betty, this is what's going on today. The doctor has ordered, according to the chart, you getting some packed red blood cells. And what this is going to do is help you as you had you were admitted for a GI bleed, okay? So we're going to actually infuse blood into you, all right? So a couple things. Has the doctor been with you to sign the consent form and explain the procedure? And she says yes. Consent form is signed. I want to advise her that, this procedure could cause an infusion reaction. So you might, if you experience any chest pain, shortness of breath, hives, itching, headache, back pain, anything like that, you need to let me know immediately because this is something that could happen during the infusion. Okay? So what I want to do is wash my hands. I'm going to obtain a baseline set of vitals and also listen to lung sounds. I'm going to look at Betty's IV site. And it looks like she has a 20 gauge IV, and I want at least 20 or above, so 2018 or even a larger bore IV would work well for this, and it's a saline lock. So at this time, I'm going to gather my equipment. So what I'm going to use here is normal saline. This is what we use to go with the blood during infusion. I have the blood tubing, a saline flush to flush my saline lock, and of course alcohol prep pads and gloves. So first thing I'm going to do here is prime my bag of normal saline. I'm going to look at the saline, make sure it's not expired, which it isn't, make sure there's no clumps, it's not cloudy or anything like that. I'm going to take my blood tubing here, make sure it's not all entangled. This blood tubing is good for 4 hours when infusing. After 4 hours, we need to change the blood tubing. And keeping the tip of this sterile, I'm going to insert it into the normal saline. I got it all clamped off here. Hang this up. And that will be a cap on there in real life. What I'm going to do, open my roller clamp and I prime the line in normal saline. And I want to make sure I fill the drip chamber above the level of the filter in there so I can get most of the good red blood cells. So we want it above the level of the filter there. About right there. Make sure all the bubbles are out of the tubing. Once they are, which they are, I'm going to close this off. Okay, at this time I would like to remove my gloves, wash my hands. Put on a new pair. Betty, I'm going to just make sure your IV is patent, okay? You don't have any pain at that IV site? And she says no. I'm also going to look for any redness or swelling or signs of infiltration. And I'll take my saline flush and alcohol prep pad. I want to cleanse the site, the port of the saline lock for at least 15 seconds with the alcohol prep pad. I'm going to take my saline flush, prime it, make sure all the bubbles are out of it, connect it, I'm gonna just flush 10 cc's of normal saline into my patient. Still looking for any swelling, redness. Make sure the saline flushes good. There's no pain, right, Betty? And she says no. All right. Throw this in the garbage. Okay, so at this point, I'm going to, the blood has been ordered, so I want to wait for my partner to come in with the blood, which here he is right here. Hey, Yusuf. All right.
There's your blood.
So Betty, we're gonna just confirm your blood for you right here, okay? With my partner. All right, so we have Miss Betty Jones.
Betty Jones.
All right, we have a medical record number of 224466.
224466.
Account number of 123456.
123456.
Red armband number of 456654.
456654.
Donor pool number of 7890.
7890.
And we have 4 units in the pool.
4 units.
Patient blood type is B positive.
B positive.
Donor blood type O positive.
O positive.
And expiration date and time of 12/15/21 and 2000 hours.
12/15/21 at 2000.
Okay, then we should be ready to go. Thank you.
No problem.
All right, so at this time I can put on some new gloves, and I would have put on the gloves prior to handling the blood. I'm going to also look at the blood, make sure it's not expired once again, make sure there's no clumping in the bag, no clots or anything like that, which it doesn't appear to be. All right. So I'm going to prime the blood. I'm going to make sure the saline is clamped. My rollers are closed, which they are, and the blood is also clamped. Prime my blood bag, hang it, and then what I'm going to do is open my roller clamp here and open the clamp here, and I'm going to wait till I see the pink blood come through. Alright, I see it's pink, and I want to flush that blood because of the fact that, you know, if I'm setting this at 50 mLs per hour, I'm going to be sitting here forever waiting for the saline to flush if I don't flush the blood to the tip of the end of the tubing here. So we're all good, we're primed here. Alright, so what I'm going to do is connect this to the pump. Roller clamp is closed. I'm going to turn on my pump. While I'm doing this, once again, I want to confirm my patient's name and date of birth, and also the possible reactions. She said Betty Jones, 5/21/1952. She responds to me. I'm going to clean the hub one more time as I'm putting on new tubing. At least 15 seconds. Connect it. I'm going to explain to Betty that if she has a reaction, she needs to let me know immediately, as I will stop the blood transfusion, flush it with saline, notify the physician. I'm going to go to new patient, and I'm going to medical surgical, yes. Confirm the patient's ID. Pick channel A. Guardrail IV fluids. I'm going to go to B, where it has blood RBCs, and I'm going to confirm that. According to the order, I'm going to reconfirm the order once again in the MAR, and the requisition rate 50 mLs per hour. And volume to be infused, there's 250 mLs in there, so I'm going to cut it short and put it at 200 so I don't run the line dry. All right. Once I have that, I'm going to start it and open up all my clamps. I'm going to be with the patient for the first 15 minutes where I'm going to monitor vital signs and temperature, check for any reactions, of course. Let her tell me if there's any itching, hives, chest pain, back pain, shortness of breath, anything like that. So according to the facility policy, it could be 15 to 30 minutes, and then after every 15 minutes for the first hour, I'm going to go every hour, monitor vital signs. If the order says to increase the rate, I can do that at that time. I'm going to continue monitoring the patient. I'm going to document everything everything in the blood, what type of blood, where it was, what time and date, what kind of line it is through, any reactions that the patient might have to the blood, any complications with it. Keep in mind that I have 30 minutes to infuse the blood, and then 4 hours, 30 minutes from the time it comes from the bank to the time I infuse it, and then I have 4 hours with this blood to remove blood. I'm going to keep my patient comfortable, give her a call light, put her in a position of comfort, keep her safe. Ask her if she needs anything else, give her a call light, clean my area up, and wash my hands, and that's it.